It is important to note that the restructured Ministry of Health and Child Care represents a complete change of philosophy which will put an end to the incessant problems that had dogged the national health care system for years. It is our conviction that most of the problems, if not all of the problems in the national health care systems, were a product of a wrong configuration. In the area of clinical services, when Zimbabwe manages to avoid patient's export or a patient referral bill alone through local treatment capability, we shall be able to make an equivalent saving. In other words, we can turn the logic around and aim for a medical tourism. In addition, considering that the country's medical supplies import bill is high, our hospital equipment manufacturing should be able to reduce this bill significantly. We are convinced that a new structure of Ministry of Health and Child Care shall make our national health system a net exporter in the short to medium term. We shall deliberately offer services that are also offered worldwide by other efficient health care systems through 1, medical tourism and biomedical science services, 2, biomedical engineering, and 3, pharmaceutical and biopharmaceutical engineering. In addition, the situation of the institution of the Health Inspectorate, logistics and asset management, health attaches, and the legal services directorates is designed to result in savings by stamping out leakages in the Ministry of Health and Child Care procurement and management systems. On the conditions of service for health professionals, the Ministry of Health and Child Care new structure includes the Critical Infrastructure Planning and Development Department, which is key to the provision of accommodation for health professionals, among other infrastructure needs. Housing and vehicle loans will also form part of the improved conditions of service. Local manufacturing through the implementation of the triple helix model will ensure sustainable availability of personal protective equipment, PPEs, which had become a drain on the national foreign currency reserves. Finally, we have now reviewed salaries and allowances for health professionals as a way of government commitment to make the national health care system competitive. To this end, an overall increase on health sector specific allowances will be effected by government. We are convinced that salaries and conditions of service are bound to further improve and be more competitive in the short to medium term because of the import substitution measures that the new Ministry of Health and Child Care structure is now representing.
For these and other stories, visit our website www.263chat.com. Follow us on Twitter @263chat and like our Facebook page 263chat.